Hello, I'm Dr. Charles Garner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. I'd first like to provide condolences to family members who've lost loved ones from COVID-19. Over the past week, we've had an additional 5 deaths, 3 at a long-term care facility and 2 out in the community. I do regret your loss. So at this time, I will provide more information on those who passed that situation as I work through my report. But to begin with, this morning we have a total of 1,181 cases to date, and this is up by 100 since I reported a week ago. And just to put that into context, the week before that, I indicated that we had 125 cases over the preceding week. So that's a high number, but it's actually down by a quarter compared with before. We, so far this week, through the weekend, have had 60 cases and yesterday in total. So 43 through the weekend and 17 yesterday. If we look at the most recent cases, the 17, they are all sporadic cases in the community. 9 are males, I beg your pardon, 8 are males and 9 are females. They range in age from under 10 to in their 60s. 16 of them are in Simcoe County. 1 of them we don't yet know where they live. 5 of them were acquired in the community, 5 were close contact, and 5 are still under investigation. They're all self-isolating. If we look over the past week and ask ourselves where have people been acquiring their infections, it's either been community acquired or it's been in close contacts of cases in the household. So the pattern continues that we've got transmission happening where we haven't been able to link it, or transmission then happening in households. And those households can be people who are related, or it can be people who are not related, such as groupings of young people, students living together. And then we also have some outbreaks related to workplaces as well. We continue to have exposures in schools, but no outbreaks in schools. So we've had to date 30 individuals who've been in the school environment and have been cases involving 27 schools, both elementary and secondary schools, but no transmission, as I'd said. If we look at how that's played out over time, over the past week, we've had 3 of those situations, the week of the 18th of October, the week of the 11th of October, 7 of those situations, of those cases, and the week before that, 5 of those cases. We maintain a dashboard now on our website under health stats. From there you can link and have a look at it. It's meant to show you at a glance what our status is. Last week I indicated that overall we were considering ourselves to be of a yellow alert status, where the possibilities are green, yellow, or red. And this week we remain at yellow alert. We remain at yellow with regards to the category of virus spread and containment, even though, in fact, the number of cases has dropped over the past week compared with the previous week. We remain in red status with regards to laboratory testing turnaround. It has improved a little bit, but still consider ourselves to be below the standard. We remain in yellow status for health care capacity because of a high acute care bed utilization at this time, not from COVID, just in general use. And we have ourselves down as red status for public health capacity because we continue to have some delay in the time of our response to cases and contacts. Our goal is to reach cases and contacts within a day, or to have 90% of our cases and contacts reached in a day, and at this point we're reaching 72.8% of our cases within a day. That's an alert status, but unchanged from last week. In terms of our trajectory, we, as I'd indicated, have had a reduction in cases over the last week compared with the week before, and that is a good thing. Of course, we need to watch this from week to week before we be sure that that's actually the beginning of a trend and not just a short change. So we don't yet know whether we've reached the peak or not. It's too, but it's good news to have that happen, going in the right direction for the past week at least. With the cases we've had, our incidence per 100,000 population over the week is 15.5, so that's down from 22.5 the week before. And when we look at the province's trajectory, while we've gone down, they've continued to go up. So this week they were 36.1 cases per 100,000 population, and last week they were 34.5 cases per 100,000 population. So our average daily growth rate has also gone down, in keeping with case counts going down. The doubling time, the duration of time in which we would double the number of cases has increased slightly because the rate of transmission has gone down. So good news for the moment, but we need to certainly continue all that we're doing to flatten the curve again, and we need to watch closely to see if in fact this is the beginning of a downward trend or not for us. I always like to remind people that it's up to us all that we flatten the curve the first time through our collective efforts, and if we're gaining control now, it's the same. It's people physically distancing when they're out of their homes, sticking to your household for close contact, hand washing, self-monitoring for symptoms and putting yourself in isolation if you develop any symptoms, and seeking assessment and testing, and using face coverings if you're in indoor public spaces and workspaces, or for that matter if you're outdoors and cannot physically distance. I'm going to turn now to our outbreaks. So we are actually down in the number of long-term care facility outbreaks. We had 3 last week. We're now down to 2. The outbreak at IOOF is over, and that was always a very small outbreak. We now continue with more cases and very sadly more deaths at Simcoe Manor. So at this point we have a total of 68 confirmed cases at Simcoe Manor. 23 of these are among staff. Not all of those staff live in our jurisdiction, only 21 of them. The remainder live out of our jurisdiction. And 40 of the residents are confirmed cases as well, individuals hospitalized. And as I'd said before, we've had additional deaths in the past week. So we're now up to 7 deaths that have occurred in that outbreak. We continue working very closely with that facility, with Simcoe County as the operator, with RVH, who've been brought on as leads in response to the situation, with Stevenson Memorial, continue to provide us with personnel and resources and expertise as well. So certainly every agency involved, everybody involved is working very hard to bring that under control. Everybody at the facility has been tested a second time, and we continue with stringent infection control measures and continue with providing through the participating agencies additional human resources to respond to that situation. And we continue with an outbreak at Bradford Valley with 2 staff who tested positive, but no other individuals affected. They were declared as an outbreak on October the 7th, so they would be very close to finishing as an outbreak if they have no new cases. We have 1 group home that was declared an outbreak on October the 17th, a single staff person with no residents. So there's ongoing management and investigation of that outbreak. We continue with outbreaks in other work settings, 3 in total. So we have a manufacturing facility that is in Simcoe County that has had an outbreak, and they have had a total of four cases at that location. We have had an outbreak at an agricultural processing plant, food processing plant in Simcoe County, and to date there have been 24 confirmed cases among staff, and investigation continues with regards to that situation. So at this point, I think I will turn to my media notes. So one thing I would say is that we are proceeding with providing vaccination for the students who had been in grade 7 in the spring, who missed their second round of vaccination against hepatitis B, HPV, and meningitis. We will be providing that in our own premises, in our clinics here at the health unit, and we'll be communicating to the families of those students via letter through the school boards in order to enable that to happen. So that's going to begin on November the 2nd. This year, we will not be able to provide vaccination to grade 7 students. So the group that I just spoke of were in grade 7 in the spring, are now in grade 8, so they'll be getting their second lot of vaccine. But those who are coming into grade 7 now, we will not be able to provide those vaccines until a year from now. We will be planning to do what we call a double cohort, or 2 grades together to do catch-up at that time. Also like to announce that influenza vaccine is available in the community, can be obtained from family physicians and pharmacies. It is being produced over time, so from now through November, and so you should be checking in for availability of vaccine. It may take time before everybody can get vaccinated, so we would ask for people's patience and ask that you actually inquire about the availability in order to be able to get that done. But certainly we encourage people to go ahead and get vaccinated. This is a very important year to be vaccinated against influenza. It's always a serious matter to avoid influenza, but certainly one wouldn't want to have influenza in the year in which we also have COVID-19 as a pandemic happening. We do have information on our website about the vaccine, and so feel free to have a look at that information. We also have information on our website about something called Simcoe Muskoka on the Move, active transportation promotion. And basically the idea with this is that it is good for everybody's health to walk, to get things done. So for children, walking to school, or teachers for that matter, if you live within range, walking to your school is good for your health. It's a good way to get fresh air. It helps reduce the amount of traffic around schools if you're not contributing to it, but instead walking yourself. And being outdoors, it's an activity you can do that's low risk for COVID-19. So we are promoting promoting this and do have some information on our website. If you visit us on the Move pages under physical activity on our website, you'll get more information and tips about how your children can actively get to school. A reminder about Halloween, which is coming up in under 2 weeks. First off, that it is always an option not to participate in Halloween. That would be the safest option, both in terms of trick or treating, but also providing candy. Certainly, if you have concerns, in particular about your health, and have risk factors that could put you at a higher risk, that would be all the more reason not to participate. If you do choose to participate, then we do have recommendations on our website about how to reduce that risk, and they align with the province's recommendation. Avoiding gatherings while doing so, sticking with your family members as you do so, keeping physical distance, both for those that are trick-or-treating, but also those who are providing candy, so setting things up so that you can maintain a 2-meter distance, although at the same time not setting up a common candy bowl where everybody's reaching in together. If possible, wear a face covering as well as an option. Remembrance Day is coming up, and of course it's very important that we recognize our veterans, our fallen heroes, and that we also know that this is the year of the pandemic, and so it needs to be done safely. So the safest means would be attending remotely, televised or by internet means. If you do attend in person, there needs, for those that organize the events, there needs to be a recognition of the gathering limit of 25 persons to be maintained at that level or less, and a physical distancing of 2 meters. People who are considering going should also consider their own personal risk. Are they at added risk because of their health and age? And so that would be all the more reason to choose to attend remotely instead. And if at an event you find that you cannot physically distance, that you should be using a face covering, even if it's outdoors. So we have some media questions that have been sent to me in advance, and they are as follows. Roughly, how often has a health unit been successful in determining a specific source of each case for COVID in the region? And the answer to that would be that in just over 70% of cases, we've been able to identify a connection, a contact, a means of transmission. 29% of our cases we consider to be community acquired, which means we don't know exactly how they acquired their infection. In the past week, that's actually 27% for us and 50% for the province. Another question is essentially the same as how often is the health unit able to determine the source? And that would essentially be the same answer, that just over 70% of the time we've been able to identify the source. Has a source been determined yet in the Simcoe Manor outbreak? Will that information be released to the public once it is determined? So that's still under investigation, and I would say we often do not know exactly how these outbreaks begin, exactly how it gets brought into the facility. The majority of the time they begin with staff cases, or at least they're the first cases that we know of. And in fact, although staff do exercise caution and self-monitor and self-exclude if they become symptomatic. For 2 days before they're symptomatic, they can still be infectious to others. And so there's no way for them to know that. There's the routine testing that happens every 2 weeks for staff, but that can easily miss people who are incubating and don't yet have a positive test result, or who contract the infection in the interim. The majority of the time, the most likely source of staff, but often we don't know for sure. And in this case, we don't know yet. I think we would have to wait and see with regards to future communication about that outbreak. Final question, is information collected through the Ontario COVID-19 app shared with local public health units to help with the notification, why or why not? So by its design, that app provides information only to the owner of the device that is carrying the app. Nobody else knows it. Their privacy is protected. There's no database in which that information is stored. So therefore nobody else can know it. And so if that individual who gets a notification indicating they've had an exposure, when they get such a notification, it rests with them to take action to deal with that. We actually require with the order that I issued a few weeks ago to the community, indicating that people who have had an exposure to COVID-19, a high-risk exposure, as well as cases of those with symptoms, need to notify us. Because of that order, people who end up with a positive result on their COVID app are required to notify us, but we don't have a means of finding it out unless they tell us. It really rests with them in the end to notify us and to isolate themselves. So that brings us to the end of my questions. At this point, I'd be happy to take any questions.
Okay, thank you, Dr. Gardner. Chris Simon, would you like to go ahead?
Sure, thank you very much. Dr. Gardner, on the health unit's list of current outbreaks, it says that the Simcoe Manor outbreak was declared on September 29th. The county has consistently said October 2nd. Can you tell me why there's a difference in those dates, and maybe walk me through those couple of days to show how you got from a respiratory infection to COVID-19?
I had actually thought it was the 2nd of October that we'd been first notified of cases on the 28th, I had thought. So I'm going to have to look into that difference and get back to you.
Meeting demands for contact tracing. So I'm just wondering whether or not you think it might be time to start publicly revealing the names of locations, businesses, workplaces, that type of thing, where that have been connected to cases.
So when we've contacted all the cases, and we do reach all the cases, we do actually get a listing of their contacts. It's not that we don't know who they are. What we on occasion have been doing is asking the cases to notify their contacts and giving them a script as to what to say. So it's not that we don't know who they are or how many there are, or whether there's a situation with a business where there's been an uncontrolled exposure to the public. And therefore, we wouldn't be changing our practice with regards to when we would notify about an affected business or not. As I said before, we do notify with regards to public agencies, such as long-term care facilities, or if we have one in a school, the school. But we haven't been doing that for
And what was the third?
There was another manufacturing facility as well. I unfortunately didn't have it in my notes as to the numbers to provide, but if you wish them, we will put them out after the fact to you.
Okay, and I wanted to ask as well, with the latest sort of close contact and community-acquired cases, have you noticed any commonalities or sort of risky behavior that each of these cases there might be a trend or something that's causing the spread?
Well, there continues to be some family gatherings, including I'm aware of one on Thanksgiving, right, with some travel involved to other family members. So that continues to happen. People, to some degree, are not abiding by my recommendation or the province's recommendation that they stick only to household contacts. So that would be one. Another would be some of the households can be fairly large and crowded, and so that becomes a risk factor in and of itself. The people involved, it's not as though they are doing anything that's contrary to our advice. It's just a setup to begin with that once infection enters the home would be difficult to prevent transmission from happening throughout the entire household. There's also interaction back at work as well. So people in these households often have jobs and end up potentially place. And what I think saves us from transmission in those workplaces is the control measures that are now required, the physical distancing, the mask use. And it's really critical that employers continue to maintain those safety measures and that employees abide by it as well, and that they exclude themselves from work.
And just one quick follow-up to that. There's a lot of cases sort of under 40 age group, but not necessarily as many as the kids. Mm-hmm. However, that's the age group that has kids. So are you noticing any indication that kids may not test positive, but their family could, and perhaps they're spreading it without symptoms?
For sure, we've had some child cases as part of family clusters. For sure, children who are close contacts, high-risk contacts of cases in a family setting or otherwise are being isolated and referred for testing. There might be some instances where
I do, thank you. Dr. Gardner, our cases in Muskoka for October are largely people between the ages of 18 and 34, and then 45 to 64. People are asking why. So I was wondering if you could reiterate some of the reasons we might be seeing cases in those specific demographics.
Well, we did have, although that was, I think, in September, a cluster associated with a work environment, the pita pit, you might recall that. So that's a work exposure. We've had, I think, the pattern of household clusters. On our website, we actually have a figure, a schematic that illustrates transmission happening between two workplaces, multiple households, and two communities. And it's not actually Muskoka, but I think that's a good illustration of the kind of dynamics that can be happening. Infection related to potentially work exposure, but also socializing. People are socializing. The age that you've listed are prime ages both for work, so people can be very socially active in those ages as well.
Thank you. I was also wondering if there might be any effect on the types of cases we're seeing based on changes to testing criteria. So have changes to testing criteria affected the results we're seeing in terms of testing?
Well, one of the things we look at, to see if we're doing enough testing is something called the percent positivity, and we always want that to be low, below 3%. The lower it is, the more saturation we have of testing out there to pick up cases. And our percent positivity was as low as 0.3% at one point. It's come up to 1% at this time. And the provinces is just above 3% at this time. So that would be an indication that there's more transmission happening versus the amount of testing that's going on. I think people were challenged a while ago when through September when the demand for testing really took off and you had those lineups to be able to get tested. I'm sure that had a negative impact on people's ability to get tested. I'm sure we missed some people getting tested when that was going on. And the province choosing to focus on those with symptoms or those who've had an exposure, I think was actually always a good idea. We know that if you test for those with a good reason to be tested, those who've had an exposure or those who have symptoms, or those who are part of an outbreak, you're much more likely to get a positive result. If you test for people who don't have any of those indications, you'll get maybe 1 out of 1,000 being positive, and many of those would be false positives. So I think the bottom line is when we had some reduced access to testing, particularly September into October, that probably reduced the ability of some people to get tested who needed to be tested. We probably missed some cases when that was going on.
Thank you very much.
You're welcome.
Thank you, Allison. James Bowler from Coachco, do you have a question?
Yes, thank you. So Dr. Gardner, reviewing the numbers from yesterday, I know it was sort of a 3-day stretch. We had more positive cases in one day than we did the entire week before. So do you think we're seeing a sort of a spike coming into Muskoka now, or is that more of an anomaly?
Well, for sure, Muskoka has had more cases recently, September and October, than it did through the summer and in the first wave. You've had a lot more activity happening. So I think that's got to be a cautionary note for everybody. Your incidence is still lower than Simcoe's. Your percent positivity is lower than Simcoe's, which is good, but it's a cautionary note that there is circulation happening in Muskoka, that people need to take their precautions. They need to be doing all the infection control, physical distancing, mask use that I always speak of.
I did ask you this last time. I just tried to ask you again to see how and I may just continue to ask you every week how you're feeling on this. We talked about Christmas and the possibility of looking at a similar situation, Thanksgiving. But based on where things are going right now, are you still feeling that the direction, we may need to be looking at Christmas as another scenario like that?
I hope not. I'm glad we've got a bit of a downtrend at the moment here. But a week is not enough data to know that you've got a defined trend. So I think we have to wait and see. I think we need to be prepared emotionally for the fact that this is an extraordinary year, and it's going to place limits on ourselves until we can get herd immunity, hopefully achieved through vaccination, hopefully not too late into the year to come. So I think we need to be prepared for the long haul. I think we need to be prepared to have restrictions on our lives for that period of time. If it turns out that we flatten the curve for Christmas, that'll be a better thing. We'll have to wait and see if that comes. We're advising going back to social circles again that are larger than just the household. If that happens, you can have a more joyous Christmas with more family members than otherwise. But if it continues like it is right now, we'd be continuing to recommend that you just stick to your household.
Thank you, James. Ian McLennan from Barrie 360. Do you have a question?
Yes, hi, Dr. Gardner.
Hello?
It was announced today that about 24,000 tests were turned around. Of course, the government's target is 50,000. Yesterday it was 31,000. The Premier said the issue is that fewer people are seeking tests right now. Province has capacity to do 50,000, but quoting Doug Ford right now, we can't force people to come in for a test. They're not coming in. So I'm just curious if that low number is of concern to you, that we may be missing people, or how do you see it?
I'm not sure how to interpret it. I mean, people have been, unfortunately, had to receive mixed messages over time, or changes in messages about testing. They were told to come without restriction in the summer. They were told that it would be long lines and delays with turnaround. In September, they were told to restrict themselves to come only if they had symptoms or contact history, or if it was required with working in long-term care or travel related. They've received different messages over time, so perhaps that's impacted on people's willingness to come forward for testing. It's also possible that maybe we're actually starting to see a reduction in transmission, and therefore fewer people with exposures and symptoms coming forward. I don't actually have a clear understanding as to why that's happening at this time.
And one other question, Doctor. We've been, Barrie 360 has been speaking to several people within the region who I guess are classified as long haulers, that they continue to suffer symptoms weeks, months after diagnosis and negative testing or negative test results. Is the health unit monitoring those people, or what sort of contact or advice is being given? And any suggestion or idea how many of those individuals may be out there in our Simcoe Muskoka region?
We haven't been monitoring that. We've focused so far on seeking to control transmission. So I think you raise a good matter. I certainly think that that's of importance for healthcare, for the healthcare system, for researchers, certainly of great importance to people who are cases who've been affected by this. It's impacted on their lives. So at this point, public health hasn't focused on that particular question, but I think it's a worthy question.
If I could, just one quick one in light of the Christmas question that was asked. I don't want to make you the Grinch, Dr. Gardner, but one media in Toronto said they're not getting a lot of responses from mall Santa Clauses. And yes, I know it's only a couple months away, but in the situation we're in now, could you foresee where even mall Santa Clauses would be considered off limits this Christmas season?
I think when it comes to how we do the holiday seasons, whatever they would be, including Christmas, that we need to abide by the basic principles of the infection control of COVID. So we need to maintain the restrictions on gatherings. We need to maintain physical distancing. Need to maintain good hand hygiene, use of masks or face coverings in indoor spaces, places. So how that would play out with details such as Santa's, I think it would, if you apply that to, that particular side of Christmas, it would come down to distancing. You wouldn't see long lines of children to sit on Santa's knee. That you won't see or should not see. That you would need to maintain the physical distancing.
Okay, thank you for your time, Doctor.
You're welcome.
Thank you, Ian. Mike Arstolides from CTV, do you have a question for Dr. Gardner?
Always. Good afternoon, Doctor. How are you?
I'm okay. How are you?
Hanging in there. What did we get wrong based on, let's say, March, April, May, June? What do we know now about COVID-19, its transmission, the epidemiology behind it, that we now have more light shed on this pandemic and this virus?
Well, that's of importance for what do we do when we get back under control again? How do we minimize the likelihood that you'll have another wave. And it's possible that it's possible that it's impossible to prevent. It's possible that we would see future waves, and the best we could do is flatten them and control them and intervene earlier so that they're not as great and not as long. We've certainly seen around the world that most countries end up with future waves, but not all countries, right? I was looking and comparing the profile of different countries and noted that China's had very little additional activity. News a minimal second wave they were able to control. And so, I guess you could say if it's possible for them, it's possible for us. I know that in the case of China, they have very stringent controls. Same with New Zealand. It's an island state where they're able to control tightly people coming into the country and put them into quarantine, and have taken an approach of a strict lockdown approach when they've had cases, seeking to eliminate it and not just control it. So they're willing to do that. They have that opportunity. We aren't in that setting. We are part of the continent of North America, with dependent on a lot of movement and trade, including with the United States, even with a closed border. So we I think are more limited in our ability to achieve that kind of control. But I too would like to understand, when we get to a flattened situation again in the future, is there something that we need to do the next time in stage 3 that's different, that would avoid a surge, or have it delayed and be able to act sooner to deal with it. It might be that we will need more controls. We now have, for example, the requirement for face coverings and physical distancing and screening in the work environment that was put in place by the province fairly recently. I would propose that needs to continue. That kind of thing potentially could be helpful even when you get into a stage 3 situation again in the future. There might be other restrictions that need to go into place with regards to other gatherings, such as convention centers and restaurants and bars and such. It may be that we would want tighter controls on the numbers that go there, or the numbers that attend per table. I think we have a lot to learn, and I think we need to look closely at the successes of other countries that have managed, but also those that have gone through this, and what they're doing after they achieve a flat curve again in the future.
So in that vein, what do we need to do better, not only as a province but as a region, in terms of on a per person basis, a per household basis? Is it a matter of the distancing, the hand washing, the hygiene, or do you have any other guidance on what folks should be doing, other than, like as you mentioned earlier, is there that indication that households are gathering with others outside their bubble that are keeping this alive in the community? The main question is, what is keeping this increase in the infection rate high right now?
It always comes down to human interaction. People having a network, people connecting with other people in a way that allows transmission beyond their own household. It always comes down to that. And whether it's in the work, whether it's socializing, whether it's in an institution. And so I guess as individuals, we could seek to be a lot more careful in our lives about that. But we know in the summer that there were many instances of people, I think, letting their social circle, go. There's a lot of confusion about the social circle and what it meant for people. So avoiding people taking it seriously in their own lives would help, but as a society, I think we've got to ask the question: what more do we need to be doing? What more in the way of restrictions are needed? What more in the way of surveillance is needed? Do we need to be acting sooner with the rise of cases in order to bring it under control sooner? I think we have a lot. We have a lot that we've got to learn if we're to reduce the likelihood or reduce the severity of a future wave.
Okay, so based on that, what would you say is the main source of the infection? Is it plausible and probable, likely that it is the interactions among young people bringing into that household or folks in a work setting? Because if you are in a work setting and you are indoors, let's say at a Canadian Tire in the south end of Barrie, and all the protocols are being followed, where's it coming from? Is it coming from younger folks who are, maybe not showing symptoms? What does our contact tracing and evidence provide, or do we not have simply that information available to us?
Well, we certainly, that schematic that I told you about that's on our website that shows, just as an example, a cluster that involved 2 communities and different workplaces connecting with multiple households. And it shows how people are connected. They're connected through their work, and then they're connected socially, and they're connected between communities, so it can transmit between households, work, and between communities via that means. And we do know that in September, there was a surge in young people, young adults as cases. That was new, that hadn't happened before. And following that surge in October, because of long-term care outbreak, we've had a great increase in the number of seniors that have been impacted now. So in my mind, the greatest challenge is young people, whether it's through work, and work can also be socializing. You can have young people or people in general at work who abide by the control measures and wear their mask and keep their physical distancing, but then socialize together after. At a restaurant or a bar, close to each other at a table. And we know that we're missing 29% of the transmissions. We don't know how they happen. They could happen in those environments, and we just weren't able to trace it despite our best efforts. So I would say that between work and between socializing, this time around, this wave has been led by young people. Now we're seeing older people, but it began with younger people.
Exactly what I wanted to hear. Thank you.
You're welcome.
Okay, thank you. Is there anyone else on the line that we may have missed? Okay. I would like to thank everyone for joining us today, and we will see you again next week. Thank you. Bye.
Goodbye, everybody.
Thank you, everyone. Sure.